My question is, sir, with the majority of the people not wanting cuts to Medicare or Medicaid, why did you vote to dismantle Medicare and give more tax breaks to the rich?
My gosh, I'm not aware that I voted that way. What bill was that, did you think?
Wasn't the House? Aren't you with the House?
He's in the House, yes.
Oh, you're talking about the House budget?
Yeah, the Ryan plan.
Let me clarify that, because it did not hurt Medicare. We're trying to save Medicare, among other things. And two parts about it as far as Medicare. First of all, anyone 55 years or over doesn't touch them in any way, shape, or form. Those under 55 are going to have a choice of health care plans. They are still going to have health care coverage, but they're going to be able to pick and choose, which is better than the government dictating to them. So the reason is, if we do nothing, it's going bankrupt. And so for anyone 55 or over, again, not touched in any way. For those under, they will have a choice of health care plans. If they can't afford them, the government will help them pay for them.
What's interesting is I didn't know that we had a Democrat here, which is awesome. It's not an insult, Louis. It's really not. I mean, I appreciate there's a diversity of thought process here. Unfortunately, you believe the president, and the president was not telling the truth about Ryan's plan. You should study Ryan's plan.
I've studied it, and
you say it dismantles Medicaid and Medicare.
Yes, sir.
Absolutely incorrect, but I love you like a brother. I really do. No, I really do. I thank you, Louis. Who else had a question here? One of you two did, right? No? Oh, you're with him? Okay. Anybody over here? Okay, right over here. Okay. What's your name?
Hi, my name's Mike.
All right, Mike.
Mike.
I got it.
Thanks for being here, for starters. I have a two-part question.
Sure.
You talk about the Constitution. Are you for states' rights? If they have a law that contradicts the federal law, do you think the state law should trump the federal law?
I think the 10th Amendment to the Constitution says that states' rights is predominant, and that's the way I feel as well.
And then, so on that note, you put on your website that you're well, there's just is a logical question for you. So there's 16 states that have medical marijuana laws out there,
right.
And so you want to take my federal dollars to basically waste them by going into those states where those people want that. And I just don't. I mean, help me understand the logic, because I mean, if you believe in the Constitution, if you believe in states' rights, then if that's what they want to do, then let them do that. Just don't do it in my state, but they can do whatever they want in their state.
But when it comes to federal crimes, for whatever reason, then the federal government does predominate there. And if there is a federal law, which there is in existence right now, that says it's illegal to use marijuana, states cannot therefore violate that federal law. Now, if there is no federal law, of course, the states can do what they want to. But when it comes to crimes, if you don't have, a capital punishment standard or whatever it might be, you would end up with a situation that really would be chaos as far as the different criminal laws go. So I happen to think the federal drug laws are desirable and justified. And I think marijuana can lead to other types of drug use. But when that debate occurs, I think it's going to have to be Congress that decides whether or not, or what the penalty should be. And right now, if you have a mismatch, I just think when it comes to federal laws dealing with drugs, that's when the government has already spoken, that law has to be enforced. Otherwise, there's no federal law that can be held.
It's an interesting debate that's still to be had, and if I'm reading it right, and by the way, I'm for legalization of marijuana. If we can drink, we should be able to smoke pot. I don't do either, but I think we should tax the hell out of it, and it would cut down the deficit by a lot. It take away a lot of black market crime as well. Having said all of that, this debate has to happen. There could be a federal law that goes against what the Constitution says, because the 10th Amendment does say if it's not in the Constitution, then the state has the right to make those decisions.
That's correct.
So those states can sue the federal government for those laws, and they can hash it out in court. Yes, Donald.
Wanted to go back to health care for a second. Sure. Joe and I have talked about this a lot, and I think a lot of people realize tort reform will help.
Here's something funny. I had no idea this was that Donald. I had no idea that was you.
Tort reform would help. Insurance reform would help. But actually, it was a phone call, that interview that Joe had with Dr. Campbell, that got me back to focusing on what the big problem is. They didn't go and focus on the uninsured. What they did was try to take over the whole industry.
Right.
Here in San Antonio, we put $1 billion into our own health care system to take care of the uninsured. That's what these health districts do. And my idea that I've thrown back and forth with Joe sometimes is it'd be nice if the federal government matched that. And I think that would pull some Democrats like Charlie Gonzalez maybe, or Henry Cuellar to this side. Do you think they would be tempted?
That I like that idea because it's a private sector solution in lots and lots of ways, and it seems to be working. I can't guess whether we'd pick up some Democratic votes or not. I would hope so. Let me tell you what the Judiciary Committee did a couple of months ago that's going to save at least $54 billion if we can enact it, and that's a conservative figure, is we passed what's called medical liability reform. It's a form of tort reform. 40% of all lawsuits filed today against medical personnel, be they hospital administrators, nurses, doctors, or anyone else, 40% of all lawsuits filed against them are frivolous and without merit, according to a Harvard study. And so if we can reduce those frivolous lawsuits, we are going to save individuals from seeing their reputations damaged, from having to spend a lot of money to defend themselves. And that contributes to healthcare costs. Doctors and others have to practice what is called defensive medicine and prescribe a lot of unnecessary procedures because they're worried about getting sued. And if we can reduce those frivolous lawsuits, those healthcare cost savings will be passed on to patients and others. So that's one thing that we're doing in the Judiciary Committee in the area of tort reform, but it's a specialized, narrow field that deals with the medical industry. But my heart goes out with them. I got interested in this whole subject and passed legislation through the House 6 or 7 years ago because I'd met with, back then it was the CEO of Children's Methodist Hospital here in San Antonio out on the northwest side. He told me he had been sued 3 times, I think, in the last 5 or 6 years. Everything had been thrown out, but he told me the tens of thousands of dollars that it had cost him. And one of the times he had been sued was because he opened the door of a patient, stuck his head into the room, and asked the parent how the child was doing. Totally benign, totally unselfish, totally interested, and was sued. And when you have to defend yourself against those kinds of frivolous lawsuits, it does still cost money, and unfortunately. So we're trying to eliminate that. We're trying to do on the federal level what actually the state of Texas did in 2003, and that has helped lead to more doctors coming into the state. Premiums have gone down, I think, 35, 36, 37%. I'd love to do that on the federal level. By the way, getting back to states' rights, we wrote the law so that any state who had medical liability reform in place, we did not supersede that.
Like Texas.
We respected that. Like Texas, like California.
Any other quick questions for the congressman while he's here? Okay. Congressman, do you get into the local issues? Do you think we should be changing Durango to Cesar Chavez Boulevard? I mean, spend $100,000?
This is when I'm grateful I'm not on the city council, I have to tell you.
I mean, I just think that it's a waste of money. Okay.
Yeah.
When it comes to the state of Texas, how are we regarded in the Congress? Because I know the president is always assailing us.
Yeah,
how are we looked at? I mean, do people behind closed doors say, "Man, you guys are doing it right," or they don't like us?
Well, first of all, the Texas delegation in Congress is united, I think respected. We're the largest Republican delegation in Congress, but we're the largest delegations regardless, 32 of us. And I have to say I do detect in Washington, and maybe it's this administration, a little bit of anti-Texas bias, a little animus there. And you mentioned a while ago, Joe, with the wildfires.
Jealous.
Why do other states get designated as disaster areas and Texas not, with the 2.2 million acres burned, 400 houses, individuals killed? Why was that not an automatic by this administration? You just wonder what's going on. They've enforced EPA regulations and made Texas subject to those in ways that don't apply to other states. So you wonder.
And the shuttle is going to New York. Hello.
You wonder what's going on. By the way,
right.
the whole shuttle program and what's being done to NASA shouldn't be done to NASA.
Right.
And that hurts us in Houston area as well. I'm on the space subcommittee, and that bothers me a great deal. By the way, starting next year, we're going to be paying Russia $3 to $4 million for every U.S. astronaut that goes up.
And on that note, let's thank Congressman Lamar Smith.
On a positive
there you
note.
go.
Thank you.
Thank you so much for coming. It's Congressman Lamar Smith. I'm going to run upstairs, Congressman.
Joe,
thank you very much.
Good to be with you.
Keep it here. We're going to have news at the bottom of the hour. Plenty of your phone calls. And Lou, if you want to call in, we can continue discussing that. I think it's a good discussion that we should have. Keep it on News Radio 1200 WOAI.